Guys, in this video we want to look at this septal button, okay, which is used to repair a septal perforation, okay. So basically we just want to look at this button. So basically whenever there is septal perforation, look at this, there is a perforation in the nasal septum. You can see that here, right? There's a perforation in the nasal septum. Now this has to be fixed. So what they do, they will, this is a realistic image where they're showing a perforation, right? So if they want to repair this, one of the options they have is this septal button, okay, which they use to close this perforation. Interestingly, this button here, it is not clear, but look at this image here. So they're also calling this a thin Silastic button, guys. They're calling it as what? Thin Silastic button. That is something to do with silicone, right? Actually, this button is a button that, you know, from two sides you can open and press them together. So that kind of a button. So they are putting one from this side and one from the other side, and they are kind of, buttoning it up. Interesting, right? So basically, this is worn to get relief from the symptoms, okay? So that's all is this Silastic. It's silicone plastic, you can say, Silastic button, or it's also called as septal button, okay? Treat what? Septal perforation. Now, septal perforation we have not covered here, why it happens and all that, but just generally if you want to know, basically trauma can happen and hence there can be perforation, right? Somebody can put ornaments there, some cauterization of the septum, during some operation it can happen, mucosal, during SMR operations, okay, due to chemicals it can happen, right? Pathologically it can happen because of septal abscess, or some rhinolith, neglected foreign body, okay, that these can cause some necrosis, then nasal myiasis. Now you know that there is bony septum and cartilaginous septum, right? So if the bony part is affected, guys, if bony part is affected, it usually can be because of syphilis. If cartilaginous part is affected, it can be because of tuberculosis, leprosy, etc. Okay, so syphilis affects the bony part, tuberculosis, leprosy can affect this part. Vaginous syndrome is vaginous granuloma is something that can affect both, okay, bony or cartilaginous. It can cause complete septal destruction, total septal destruction, okay. And also some people who use cocaine, right, some people who use steroid sprays in their nose, some people because of their occupation, right, who do chromium plating, dichromates, some sodium carbonate manufacturers, etc., who are exposed to arsenic, those people also can have the septal perforation, okay. Some people have all this perforation because of no reason, that is idiopathic, okay. Then, what will be the problems for these people? The problems for these people will be like a whistling sound, right, whistling sound when they breathe. And also there can be some crust formation which will start obstructing their nose, right? And there can be severe epistaxis, nose bleed, right? When removed, these crusts are removed, okay? So those are the problems these people have. How will you treat? Basically, you should find the cause, right? You should find the cause of these conditions and try to treat the cause. You may have to do a biopsy from the granulations, right? You will have to find out, right, if it is syphilis or tuberculosis, etc. So small perforations you can close with some flaps, right, plastic flaps. If there are large perforations, so they are saying small perforations you can close with some plastic flaps. If there are large perforations and they are difficult to close, so you will just give some alkaline nasal douches so that these crusts don't form, okay. So alkaline nasal douches will give. Then basically they'll give some ointment to just apply over that, a bland kind of an ointment. Okay, and finally they are mentioning this Silastic button. What button? Silicone plastic, Silastic. It is actually combination of those two words, I think. Silastic button. Okay. To get relief from symptoms, you can use the Silastic button. So they are showing that here. Thin Silastic button. From two sides, open it and press them together. Okay. So that's all for now. We wanted to cover about this button. It's done. Bye bye.